and Maite. Imagine waking up in the 19th century, where the cities became more and more populated as the filth rapidly increased. There was sewage covering the whole city because there was nowhere it could be taken to. Everywhere death was occurring as the diseases spread, but no one knew why. Then, one miraculous day, they tracked down the problem: uncontrolled sewage. Though they knew where the problem came from, they didn't know how to stop it. London suffered the consequences of not knowing where to put the waste, as the city doubled its population over time. The city was facing the diseases that the waste would give them when drinking the water from the river. People started throwing the waste to the River of London, where the majority of the people got their water from. They lacked knowledge as they tried finding the reason for the diseases. Dr. Joseph Bazalgette was the first person to realize the problem the city was facing. He also was the person to invent the sewer system. No one says the job was easy, but it was possible. The lack of resistant materials, money, and agreement were some of the obstacles he had to overcome. The prerequisites for the adoption of sewer system in the modern city can be broken down into three categories: needs, resources, and values. City dwellers who began constructing sewer systems and incorporating them into modern cities had to fulfill a fundamental need in order adopting this innovation. Sewer systems have become part of modern cities in order to satisfy mainly the need of hygiene and sanitation. According to a group led by Elizabeth Isola, an expert in Victorian London from the University of California, Davis, the main cause of these illnesses was attributed to the poor sanitation conditions, such as an overcrowding workforce, contaminated water, and unpaved streets with ankle-deep mud. Also, BBC History states that Joseph Bazalgette, the mastermind engineer that invented sewer systems, supported this need as well. More than 10,000 Londoners were killed by the disease. It was thought at the time to be caused by fuel air. The hot summer of 1858 created the Great Stink of London, which overwhelmed all those who went near the Thames, including occupants of Parliament. This, together with the frequent occurrence of cholera, gave impetus to legislation enabling the Metropolitan Board to begin work on sewers and streets improvements. By 1866, most of London was connected to a sewer network devised by Bazalgette. This thoughtful engineer knew exactly what was wrong with this noxious city, so he decided to make a change that revolutionized this entire planet. This led to the adoption of sewer systems because this huge city had no other choice. They were in the brink of a huge epidemic disaster. All kinds of diseases were spread, and they found out that it was due to the human excrement dispersed around the city. They required this fundamental need, the need of hygiene and sanitation. Otherwise, the horrific diseases would have scattered even more. With hygiene and sanitation, there would be less bacteria, and bacteria is clearly linked with the disease, meaning that less bacteria would equal no epidemic. Thus, engineer Joseph Bazalgette came up with this innovation, so such unsanitary and diseasely filled cities would have a safe and bacteria-free environment, with humanity moving forwards, advancing with no drawbacks. The city dwellers of the modern world could not have adopted sewer systems if a certain key resource had not been available. The most important resource that led to the adoption of sewer systems in modern cities has been advances in engineering when building the perfect structure for the underground tunnel. In addition, the guidelines of DLWC say, if calculations show that the water cannot be applied to the site of certain periods of the year, the use of site sewage management should be considered. This issue must be considered in the early planning stages. If wastewater cannot be applied to the land of a significant portion of the year, then on-site sewage management will not be appropriate. In addition, according to the government of UK, there are 57 overflows which discharge diluted sewage into the Thames 50 to 60 times a year. This shows that the advances in engineering had to be correct in order for the plan to succeed. If the calculations of the construction of the sewer systems are incorrect, the system may break down and all the waste may spill out, making a dump. They would have to measure the circumference of the circle along with the distance of the tunnel. Before, their calculations were incorrect, or not as exact. This is why there were 57 overflows. The system is supposed to lead the way of the waste to another place, maybe miles from its starting point. If anything happens to the construction, the system would be a failure, causing its functionality to result as a system that does not work. Having the correct advances in engineering of the construction was a fundamental resource for this system to work. Finally, these modern city dwellers believe in a set of values that has allowed them to continue enjoying the urban lifestyle. The most important value that led to the adopting of sewer systems was health. The city cited the Big Things Cleanup, written by Ted Hansen, which is specified in the Spreading Cholera, stated, "This further scientific proof reinforced the theory put forward by Dr. John Snow, that the disease was spread through ingesting soiled water, rather than inhaling fuel air. Although the cause of cholera was a subject of debate, it was agreed that the polluted River Thames, where the people of London drew their drinking water from, was to blame." Also, according to the article of Sanitation in Victorian London, a team led by Elizabeth Isola says, "The public suffered severely from the epidemics that included 3 massive contagious diseases: cholera, typhus, and influenza. The main cause of the diseases was attributed to the poor sanitation conditions, such as an overcrowding workforce, contaminated water, and unpaved streets with ankle-deep mud." This explosion of deadly diseases led to the awareness throughout the city. Dr. Joseph Bazalgette, a brilliant scientist, began thinking of a way to prevent diseases and somehow control where the excrement went. People in London seeked for health and well-being, but could not find it in this epidemic of diseases of this unknown source. Not only did the sewage system affect health by the filth in the city, but because of the unclear water with excrement in it. This is how the diseases spread so rapidly but unevenly throughout the villages. Thousands of people died due to the diseases caused by uncontrolled sewage. And because they valued their health so much, they had to find a way to stop this problem. It was first thought that the diseases spread through the air, by smelling the excrement, but later they found out it came from the water. Dr. John Snow helped prove the theory and created awareness. Dr. Joseph Bazalgette created the first sewer system in the world, leading to a massive industrial revolution that fulfilled the value of health around the world, created a cleaner and thriving modern cities.